Sarcomas are rare cancers that develop in the bones and soft tissues, including fat, muscles, blood vessels, nerves, deep skin tissues, and fibrous tissues. According to the National Cancer Institute, about 12,000 cases of soft tissue sarcomas and 3,000 cases of bone sarcomas are diagnosed in the U.S. each year. The University of Colorado Cancer Center have doctors and researchers who are dedicated to diagnostic and treatment innovations for sarcoma patients.
Sarcomas are a very special and rare group of cancers of bone and soft tissue. And so I describe them as being cancers of cells that hold us together. And what a lot of people don't know is that there's actually over 150 different kinds of sarcomas. So getting the right diagnosis and understanding which type of sarcoma a patient actually has is super important. So University of Colorado Cancer Center actually has a dedicated sarcoma program. And what that means is we have experts of all disciplines, everyone from surgeons to medical oncologists, radiation oncologists, pathologists, who are all completely focused on sarcoma cancer and management. So when a patient comes to the University of Colorado Cancer Center, they're not just seeing one provider, they're seeing an entire team of doctors who all work together to come up with the best treatment recommendations. So the treatment plan really varies on the exact type of sarcoma that the patient has, where the sarcoma is. They can literally be anywhere head to toe, including in the gastrointestinal organs like gastrointestinal stromal tumor, which is a type of sarcoma. And so the treatment may be very different depending on whether the cancer is only in one place, like an arm or a leg, or it's distributed everywhere. And so sometimes we'll use chemotherapy, sometimes we use surgery, and then other times we use what we call targeted therapies, which are pills often that are designed to disrupt a particular pathway that's critical to the growth of that sarcoma. We also do a lot of work with clinical trials. So what that means is that a patient may have the opportunity to have a treatment that might not be available as standard of care or even at other cancer centers. So it's super important for a patient with a new diagnosis of sarcoma, such as gastrointestinal stromal tumor or GIST, to have a comprehensive evaluation from multiple experts.
A GIST tumor is a type of tumor that falls into a class of sarcomas. It's a specific sarcoma that occurs anywhere in the gastrointestinal tract.
How I felt when I first found out, again, like probably anybody, scared, confused, why me, kind of thing.
Once a diagnosis of a GIST has been made, we have a number of different treatment options. One of the options is to consider surgery to remove the tumor, but some tumors have spread beyond something surgery can remove or are too large to remove with an operation initially. In those cases, we'll sometimes treat the tumors first with oral form of medication called imatinib that is intended to shrink the tumor and then reassess as to whether it's worth an attempt to remove it later on.
After the first scan, I pretty much found out that it shrunk three centimeters, and I was pretty much optimistic after that. And then the second scan, it pretty much shrunk half, so I was very happy about that. And then 3 months later, I got the procedure done.
So when we talk about surgery for patients with GIST tumors, if it's amenable to a minimally invasive approach, that is certainly our first choice because it can improve the recovery from the operation. However, the primary goal is always going to be what is the best operation that can get rid of the entire tumor. And sometimes that requires a bigger incision and a bigger operation to do it, but in the right setting, it's the right thing to do.
Before I felt, a lot of pain, especially in my abdomen area. Now, I think a week after my surgery, I was already walking 5 miles, so amazing.
As you may know, sarcoma is a rare diagnosis, and most physicians out in the communities might see 1 or 2 sarcoma patients in their entire career, whereas here at the university, we see dozens of sarcoma patients every week, and so we have an enormous amount of experience taking care of these patients.
University of Colorado Cancer Center is the only National Cancer Institute designated comprehensive cancer center in the state, giving patients access to the best providers and clinical trials. Their experts overcome cancer through innovation, discovery, prevention, early detection, multidisciplinary care, and education.